Invisalign can fix a couple things. I mean, obviously, it can give you straighter teeth and a better smile. One big thing we also noticed that Invisalign can help fix is like TMJ or jaw issues. Getting your bite in better harmony will, usually help alleviate some of those jaw joint issues that patients have. Um, when we're talking about Invisalign versus traditional braces and going to the orthodontist, it really comes down to complexity of your case, how crooked your teeth may be, how off your bite might be. Invisalign, in my practice, is really reserved for more simple, more routine cases. If it's more advanced, then we'll send you to the orthodontist. Average timeline for Invisalign is usually about 9 to 12 months for the cases that we're doing. Again, that all kind of is determined at that initial assessment of how complex your case may be. But I would estimate usually about 9 to 12 months, give or take. I would say what surprises patients most is how easy it ends up being. I went through it myself about a year ago, and it's just one of these things. Once you get into the routine of it, it just becomes your daily routine, and you just don't really think about it after a while. And before you know it, it's over. So the biggest thing, with Invisalign, it's going to go the fastest and it's going to be the easiest when you leave the trays in as long as possible. So we always recommend leaving them in 23 hours out of the 24-hour day. You're going to have the trays in. You're really only taking them out if you're eating, drinking coffee, brushing your teeth, things like that. Again, it sounds daunting at first, but once you get in the habit and routine of it, it's actually really easy. So, a big factor of that is our assessment. We see a lot of cases. We've done a lot of cases. So kind of trusting your doctor to make that decision. If we assess you and we think that you'd be a pretty straightforward Invisalign candidate, then Invisalign would definitely be the way to go. If we feel that you'd be better suited doing braces or going to see the orthodontist, we're honest and upfront about that. The most successful cases are the ones where, patients are very motivated and adhere to the compliance. And we recently had a patient who she came in and was a little hesitant at first about doing the case. But after, a year of treatment, and she saw just how much straighter her teeth was, how much straighter her teeth were, and how much more confidence she had, it made it all worth it in the end.